Welcome, Florian Gebhard. Florian Gebhard is the medical director of the University Hospital in Ulm and also the president-elected of the AO Foundation. His talk today is The Future of Surgery, the Digital Suite. More than 170 years ago, surgery started, but still is today craftsmanship. But environmental changed dramatically, and all the information today is basically delivered digital. As the title of his talk suggests, Florian will outline how the future of surgery will bring innovative technologies, enhanced understanding of disease, and wider collaboration among experts and innovation to improve patient cure. Welcome with me today, Florian Gebhard.
Florian Gebhard. I'm a trauma surgeon, and I will talk today about the contradiction between surgery and digital operation rooms. Surgery per se is craftsmanship. So what we need is skillful hands, anatomical knowledge, and a good training. What is the benefit of digitalization in surgery? Regarding this question, I would like to start with the history of surgery. As you can see here, surgery started with the first anesthesia in 1846. It took roughly 40 years that the first car has been developed. And as you can see here, there's a development of cars until today, which significantly changed the performance as well as the design of cars. You can see here the development of a surgical hospital, which originally was built outside the city because of infectious diseases and other risks, and has been run until 2012 for more than 100 years, which you can see in the middle image. Today, in 2012, it looks significantly different. It is one of the most modern surgical hospitals in Europe. If you look inside the hospital, you can see that during this time, it's still the operation room where we perform surgery. And the room per se has not changed significantly over 100 years. It's only the content of the room which has changed since surgery started as a own discipline of medicine. And as you can see here, it took very long that imaging systems were developed that could be used during surgery. Why do we need imaging systems? Because imaging systems can give us insight into the human body, like displaying the bones or organs. And as you can see here, in 1998, the hospital is still 100-year-old, and inside this was the first time that we used camera systems for navigation of our surgical tools. Navigation means that there's a camera system that recognizes a surgical instrument like a pointer or a power drill, and this is then related to the imaging system, the C-arm system, and by that it's like moving on a lens, on a map of the patient's anatomy. We can see where we are with our instruments, and we have the insight into the human body without opening the body, meaning that we can do minimally invasive surgery by using this technique. If you look at the patient journey today, a trauma patient is rescued maybe by the helicopter or an emergency team, and today we have systems that automatically start to analyze vital data of the patient, like oxygen levels or the pulse frequency, and transmit this to the hospital. So when the patient arrives at the hospital, we have the medical data which are related to the accident or to the injury, as well as the stored patient data which are in our digital archive in the hospital. On arrival at the hospital, the patient gets a CT scan or standard X-rays, which today are also in a digital format. then we can look at these images, we can analyze them, and we come up with a fracture classification, which is shown at the upper right of this slide. And this fracture classification defines the personality of the fracture, and by that we can define how to treat this fracture, what is the best implant for the patient, what is the best surgical strategy to treat this individual injury, as well as we collect laboratory data like red blood cell count and other things, and all these data are to be used in the operation room by us. Preoperative, there's one last step, that's the digital planning system, where we can simulate the surgery, we can reduce fractures, we can attach virtual implants, we can choose screw positions, and by that one all the information is collected which is needed for the perfect trauma surgery, that we have the implant defined, we have the strategy defined, how to address this fracture best, and all this information should be then available in the OR. And this is the huge step today. Not every OR is able to give us all the information. There are several reasons. One reason is shown here, that this is the patient journey, that he has an accident, it's called problem, and at the end we want to have a perfect surgery, we want to have a perfect outcome, and after rehab program, a full recovery of the patient. And all this digital data is collected by different systems. Some of them are named here, and there are many more available today. But the challenge is how to get all these digital microsystems, microenvironments to give their information at the same time for one patient to the surgeon in the operation room. And this is still a huge challenge. As you know, all digital systems are not talking to each other from the beginning. They have to be trained, they have to learn, and they have to share algorithms to make this possible in the OR. What we have today, and this is now running since 2012, that's the latest version of our digital OR. And as you can see, a lot of these informations I mentioned before are now available. We have the intraoperative navigation system. This is our guiding tool to make minimal invasive and precise surgery. This one is linked to the robotic C-arm for 3D images, for a full 3D sight into the body. And parallel to that one, monitor systems give us information about the vital parameters, but also about the information which are given by the preoperative planning data. And we have a so-called surgical cockpit, where in a sterile environment, I myself as a surgeon can control at least the robotic C-arm system and the distribution of the digital information to the different monitor systems. By that one, we are very close to a full digital OR, where we can use all this useful information which have been collected from the site of accident, as I outlined at the beginning, to the time point the patient is entering the OR. And what I did not mention so far is robotic systems. Robotic systems are coming more and more, even in trauma surgery. And robotic systems must be added to our digital OR, because the robot system, which is more or less a digital hand or virtual hand of the surgeon, that enables us to make more precise cuts, more precise preparation of the tissue, and more accurate steps during surgery because of this manipulation systems which are realized by these robotic arms. And also this robot system needs all the digital information which is collected from the beginning of the individual patient journey. Whether it is an injury or a tumor disease, it's always the same principle. The patient has a journey as soon as a problem arises. What is the future? The future will be that we can get more and more digital data of the patient as a whole body information. So we have the skeleton information, we have the information about how does soft tissue behave, or how do organ function, maybe like in a colored system, which you can see on the lower right. And on the top there is a surface information about the patient, because you can take the patient individual surface for registration, and by that one controls surgical instruments in relation to the patient's anatomy. So the vision in maybe some more years is that we have a full digital access to the patient individual informations, and we can utilize this digital information in order to perform our still craftsmanship called surgery more precise, more individual to the patient, and more specifically addressed to the problems which we are addressing during surgery. But by that, it will take some more years. If you look back, it took 100 years for surgery to come up to this, what I showed you today. And so we need some more surgery for the future to realize this one. And I hope I could show you that the contradiction between craftsmanship and digitalization is not a contradiction anymore. It's a combination of craftsmanship and digitalization which helps our patient and will improve the outcome in a few years. Thank you very much.